After assessing over 2,000 children and teens in private practice, I've seen a couple of patterns that pop up, especially in adolescents and teens that have both autism and ADHD, other known as AuDHD. These aren't things you hear talked about much online, and they don't fit neatly into a nice little box on explaining behavior or emotional regulation or people's motivation. Before I keep going with this video, I want to be very clear about something. I'm not offering medical advice. I'm not offering treatment recommendations or telling people what to do. What I'm doing is I'm simply sharing 5 different patterns that I've seen, especially in evaluating adolescents, that often get misunderstood or mislabeled as something else. So pattern number 1 that I see is that emotional explosiveness doesn't always mean emotional immaturity. So let me explain. One of the most common assumptions that I hear is that these teens are emotionally immature. They can't handle their emotions. That's not what I actually see most of the time. What I see happening most often is something much more specific, where they can usually tell me that they're having an emotion and they can talk about what caused that emotion, but them being able to explain their experience of that or even how they're experiencing it like physically, that becomes much more difficult for them. So let me give you a for instance, to where I may ask a question of, what does happy feel like for you? And I'll usually get the response of happy, with a question mark behind it. Or sometimes it's like, happy? Like they're confused about how to even put that into words. And I want to emphasize that point to where the emotion is there, right? It's just the subjective ability to put that emotion into words. That's what's difficult. This is the pattern to keep in mind, because when you can't put your feelings into words, especially when you're already a little bit elevated and overwhelmed, well, it can come out as blowing up and being very irritable, or maybe even reacting very suddenly or intensely without a lot of warning. And then when that happens, it can get labeled as emotional immaturity. But clinically speaking, it's more of a difficulty in emotional language and integration. It's not about their inability of having emotional depth. Pattern number 2 that I often see is shutting down after they seem fine. And I hear this a lot, to where I'll hear folks say, they were doing fine all day long, and then they just shut down. Adolescents in general, whether you're neurotypical or have AuDHD, you're under constant evaluation, right? Socially, academically, emotionally. You're being evaluated all the time. And then when you couple that with a teen or an adolescent with AuDHD, these issues are exacerbated. They're holding it together at school. They're monitoring themselves socially. They're suppressing certain reactions, but they might not be processing what they're feeling in real time. So when they get to an environment where the pressure is off, and often this is at home, that's when you can start to see them going through and processing these emotions. And sometimes that looks like withdrawing and shutting down. And I want to emphasize this point about this particular pattern, to where shutting down is not the problem. That's the cost of appearing okay all day long. The third pattern that I see in adolescents and teens pop up pretty often is that they're rigid one moment, but impulsive the next moment. This is one of the more confusing things for adults to witness. You'll see an adolescent who's very rule-bound. They're very focused on consistency and fairness and follow-through. If a plan changes at the last minute, you might hear something along the lines of, well, you didn't tell me about that, and that isn't fair, and that's not what the plan was. And then, sometimes in the same interaction, they'll do something completely out of character. They'll do something extremely impulsive. And from the outside, it can look like hypocrisy, like they're choosing not to care, or that they're trying to be manipulative or purposefully inconsistent themselves. But that's not what's actually happening. What you're seeing is autism driving a need for predictability and structure, while at the same time, ADHD is driving impulsivity. And all of that is happening within one adolescent whose system hasn't developed the skills yet on how to regulate these two competing drives. So they're not choosing when to care. They're switching between two regulatory systems that are in competition with one another. And one thing that I want to add with this pattern is to where when expectations don't go as planned, what you may see is a big blow up, right? A huge meltdown. And this isn't because that they're challenging authority. It's because their internal system just lost any sort of coherence. This was the rule. This is what was going to happen. And now that's gone. And I don't know how to make sense of that right now. A fourth pattern that I see is intense self-criticism hidden behind apathy. And this one really stays with me as a clinician, and most parents, that it also hits them too. To where on the surface, it just looks like they don't care, that they gave up, that they're just not going to respond. But once you start talking to them, like really talking to them, something different comes out. I'm stupid. I'm never going to get it. There's something wrong with me. That's often the hardest thing for me to hear as a clinician. It drives a knife into my chest. And often how these teens deliver it is they just make it sound like it's normal, like it's just a part of who they are. Like, of course I'm feeling this way. And for a lot of these adolescents, apathy isn't a lack of motivation. It's the result of caring deeply about different subjects and justice and what have you. It's about caring deeply, but then being met with repeated unsuccessful attempts at whatever that they were trying to do. Just imagine it, right? To where you want to make friends, you want to keep friends, but then time and time again, it's unsuccessful or it's not maintained. And you see other folks around you being able to make friends and keep them really easily, but then it's just something about you, something that you say, something that you do that turns the other person away. If that keeps happening over and over and over again, it makes sense that they become apathetic after a while. But again, it's not that lack of motivation. Rather, the dynamic that's happening in this particular situation is that disengagement is actually self-protection. And the last pattern that I want to talk about today, pattern number 5, is emotional disorientation. To where adolescents and teens, when they're emotionally disoriented, it can look like a different disorder altogether. Or even it can just look scary, especially when, they're not 8 anymore. They're 14, 15, 18 years old. Emotional blow up when you're 8 is interpreted entirely differently than when you have an emotional blow up when you're 17 or 18, right? And what was once defined and labeled as emotional dysregulation, like, oh, they're just having a temper tantrum, can, as folks get older, get misinterpreted as defiance, oppositionality, or even something more severe. And I see this a lot with AuDHD kids and teens, to where they'll get over-pathologized, especially when rigidity and impulsivity are colliding with one another when the kid is under stress. If things aren't aligning how they had expected, and they don't have the tools to regulate and start bringing themselves down, well, you're going to see their stress level and the intensity of the emotion go up really quick. And what this doesn't mean is that they're rejecting authority or that they're purposefully being defiant. What it does mean is that the system, whatever system that they had in place before, has lost its footing. And I want to make this part very clear. Even with supports in place, with understanding, emotional blowups are going to still happen, right? And they don't just happen in kids and teens. Even as an adult, I'm sure you've had an emotional blow up. If you really take a good look in the mirror, of course you're going to overreact now and again. Things have been building up and building up throughout the day, and then someone cuts you off in traffic, and boom, there's some road rage action happening. Adults can blow up too. So this isn't about finding the right response, so dysregulation just disappears altogether. That's just not going to happen for you, me, or especially, a teenager. It's just not going to happen. But what this does is it changes our interpretation and our understanding on what's happening, and that can change our response to it. So in closing, all 5 of these patterns have something in common, right? They're not about a lack of caring. They're not about manipulating the situation. They're not about defiance. Rather, they're about adolescent brains with AuDHD and how they process emotions and pressure and expectations. And when we understand the neurodevelopmental context, that's when we can understand the behavior and interpret it much more accurately. And not in a way that excuses everything, and definitely not in a way that makes things easy, but in a way that it replaces fear and misinterpretation with clarity. In clinical work, as a parent, as a therapist, clarity can change everything.